Hi friends. Welcome to Dentistry Love channel. Post design. Classification of endodontic posts, based on shape. Parallel. Tapered. Parallel and tapered. Based on surface characteristics it is active or passive. Based on fabrication methods it may be custom cast post and cores, prefabricated post and cores, metal post and core, zirconia post and core. Based on shape. Parallel posts increase retention and produce uniform stress distribution along the post length. Concentration of stress has been reported to occur at the apex of the post, especially in a narrow and tapering root end. The various commercially available parallel posts include the following: parallel-sided serrated and vented posts, parallel-sided threaded posts, parallel-sided threaded split shank post. Threaded tapered screw post exerts a greater amount of stress and was considered the least desirable. The parallel-sided, serrated, and vented posts were found to exert the least amount of stress. Tapered post conforms to the natural root form and canal configuration, thus permitting optimal preservation of the tooth structure at the post apex. However, this design is reported to produce a wedging effect, stress concentration at the coronal portion of the root, and lower retentive strength. The various commercially available tapered posts include the following: tapered smooth-sided posts, tapered self-threading posts, parallel and tapered combination. In the parallel tapered design, the post is parallel throughout its length except for the most apical portion, where it is tapered. The coronal parallel design provides retention while the apical tapered design permits preservation of dentin in the apical part of the root canal. Based on surface characteristics. Active posts, they mechanically engage the dentin with threads and they have better retentive abilities but are clinically not recommended as they decrease the fracture resistance of the root. Passive posts, they depend on the cement and its close adaptation to the canal wall for their retention. Passive cemented posts are clinically recommended, based on fabrication method. Custom, cast post and core, direct and indirect technique. Prefabricated post systems. Metal post, ceramic post, glass, fiber reinforced epoxy resin posts. Custom cast post and core. The custom cast post has the advantage of conforming closely to the configuration of the prepared canal. This is especially significant when the canal is severely flared. The retentive and protective characteristics of custom cast posts are such that they are less retentive than the parallel-sided posts with little or no stress associated with their installation. However, they might act as wedges during occlusal load transfer resulting in vertical fracture of the roots. Direct custom cast post and core technique. The direct technique of making a custom post and core is a chairside procedure wherein the fabrication of the resin or wax pattern on the prepared tooth is done in the patient's mouth. Some form of plastic dowel or thin metal post is used as the central reinforcement around which the resin or wax pattern is formed. This post and core pattern is then invested and cast to form the direct custom cast post and core. Indirect custom cast post and core technique. An impression is made of the post-core preparation and the resin or wax pattern is fabricated on the dental stone cast which is then invested and cast to form the indirect custom cast post and core. Posterior teeth can also be restored with custom cast post and cores. Mandibular premolars are treated in the same way as the anterior teeth. When they are used on molars, largest canals such as the palatal canal are used on maxillary molars and distal canals. Prefabricated post systems. Metal post. The most commonly used alloys are nickel-chromium alloy, stainless steel, and titanium alloy. Active metal posts aren't advocated due to their predilection for causing root fractures. Passive metal posts which are tapered in design offer least retention but allow minimal removal of radicular dentin. Hence, the commonly advocated metal posts are passive and parallel in design. Ceramic post. The main disadvantage of ceramic materials has been principally associated with their low flexural strength compared with that of metals, and in function, Ceramic materials have a record of frequent failure in high-stress situations. Preformed ceramic posts were reported to be significantly more rigid than the parallel-sided stainless steel posts. Glass fiber reinforced epoxy resin posts. The addition of fibers to an epoxy polymer matrix can result in a significant improvement in the mechanical properties of strength, fracture toughness, stiffness, and fatigue resistance of the resultant material. Fibers may be composed of glass or carbon. These post systems can be in one of the following shapes: cylindrical, conical. Carbon fiber posts are no longer recommended due to their poor aesthetics. Glass fiber posts are aesthetic and clinically popular and can be made of electrical glass, E-glass, high-strength glass, S-glass. Quartz fiber, this is pure silica in a crystallized form and provides better aesthetics. Glass fiber posts are popular for the following reasons. Post, core, and cement are resin-based and constitute a homogeneous ensemble. More homogeneous stress distribution than other metallic post systems. Better biomechanical performance with greater fracture loads. Mode of failure is favorable, allowing repair and restoration. Excellent aesthetics when compared to other that of post systems. Good adhesion to the cementing medium. Thank you friends. Please do subscribe for more videos.